Okay, for this measurement, we'll be measuring shoulder medial rotation. You need to position the patient so he is laying supine near the edge of the treatment table, shoulder abducted to 90 degrees, elbow hanging off the edge of the table. You can place a towel underneath the humerus so that the humerus is in line with the acromion process. You want them to be on the same level. Forearm, it is perpendicular to the ground, 90 degrees of elbow flexion. You don't want the forearm pronated or supinated, just in a neutral position. The motion of shoulder medial rotation is just moving the palm towards the floor. There are two components. The first component involves glenohumeral motion, and then the second portion of the motion involves the whole shoulder complex, including movement of the scapula. So there'll be two measurements that we'll be taking. As far as stabilization goes, for that first motion, you're going to the first firm end feel. You don't want to have any scapular motion here. For the second point of the motion, you will have scapular motion, but you don't want any trunk motion, so that's where you're worried about staying stabilized. For the landmarks, we're using the olecranon process for the fulcrum and the ulnar styloid process to keep the arm in line with the ulna. So let's go ahead and measure. We'll align the fulcrum at the olecranon. The proximal arm is just perpendicular to the ground. The distal arm is going to be in line with the ulnar styloid process. And then we'll go ahead and passively medially rotate the arm until we get to the first firm end feel, about here. And when you start to have any scapular motion, so for him, we're at about 60 degrees. The normal range is 50 to 60 degrees. We'll go ahead and do this again for the whole shoulder complex, aligning fulcrum at the olecranon, distal arm with the ulnar styloid process. Go ahead and medially rotate until the second firm end feel, or if there's any trunk flexion or rotation, say about here where the shoulder starts to kind of pop up. A little bit more than 80 degrees. The normal ranges for the glenohumeral motion is 50 to 60 degrees. The normal for the full shoulder complex is 70 to 90 degrees. Both have a firm end feel due to muscle stretch and ligament stretch. So his range of motion for shoulder medial rotation is normal.